I'm William Fleming. I'm president of Clinical and Pharmacy Solutions for Humana. We are a national payer that has a lot of provider and healthcare services capabilities that services 16 million customers from TRICARE, Medicare, Medicaid, group commercial, and the like. I am a panelist for the Zetema Project. Ultimately, one of the things that we gavelled down on just as a working philosophy is, what is our role on that 5-year-old soccer team? Is our role to run towards the ball like everybody else, or is our role to play our position? And we believe that everyone in this health system needs to be playing their role on that 5-year-old soccer team, that we all shouldn't be running towards the ball. That, when you think about the COVID patient and those folks who are really sick, that's the role of the hospitals and the ERs. We need to understand capacity, to be sure, but our role is to not get in there and try to help facilitate capacity, perhaps. On the other hand, when you think about all these chronic care members who are not able to get in to these hospital and other institutional settings, our role is to perhaps be a convener, to be to provide care coordination, to provide care management, to give them alternative sites to get problems taken care of while their usual and customary course has been challenged. Value-based care has really been something that's allowed the physicians practicing in that way to thrive, as opposed to fee-for-service care. On a value-based care basis, their financial stability and financial solvency is there because they're being paid some sort of a capitation payment or some sort of risk-bearing payment where they're actively engaged in the conversation financially the same they are today as they were yesterday. And that's a big deal. What that allows them to do then is to focus on that holistic person. That allows them to focus on, how do I engage the member, maybe not face-to-face anymore, but how do I use telephone? How do I use FaceTime? How do I use traditional telehealth in that engagement, recognizing that certain places of treatment are just not available today because of all the COVID and social distancing, which is a very different phenomenon than on the fee-for-service side, that those physicians probably are struggling at times because they don't have that capitation payment financially. I'm optimistic about the changes that will come about in the future of healthcare delivery in the U.S. because of this pandemic. I look at some of the things that we just cannot go backwards on, things that we must accelerate because we've learned it's good, and it's good care, and it's potentially good quality, though we still have a lot to learn. Example, telehealth. The opportunity to advance telehealth as a chronic care capability in the U.S. marketplace is showing itself during this crisis. The question is, how do we not go backwards on that? How do we go forwards on the other side of it? For example, the role of hospital as a place to solve chronic care problems versus home as a place to solve problems. We're seeing that a lot of the chronic care members today can't get into hospitals because of the obvious COVID situations. That's leaving home as a very interesting place of care. How do we take advantage of home and bring forward more doctor at home, more ER at home, more modest hospital at home capabilities on the other side of it? We're doing it in a MacGyver-like fashion today. The role of something as simple as mail order pharmacy, the simplicity of it, the social distancing, things that it can bring, and being able to make sure people have adequate medication on hand, that their needs are being addressed. Those are very important aspects. The role of connecting social determinants of health, solving food problems, solving some of these isolation challenges. If you were isolated before this, you're probably really isolated now that we've been several weeks into it. I just see so many opportunities for us to advance the health system by learning from what we've learned during this pandemic, that will create capacity that might find new ways of getting things done, perhaps at at better quality.